Professional Values and Behaviours is a new station, which is a silent station added to NMC OSCE. This station comes along with another station, known as Evidence-Based Practice, which is also silent station of 10-minute time limit. This is a writing station, and you will be given a scenario. You need to use the knowledge of the NMC Code, and need to summarize the actions you would take in number of bullet points. Luckily, NMC has provided the topics which will be asked in this station. The 5 topics which are listed on the university websites are confidentiality, drug error, possible abuse, professional confrontation, social media. Fortunately, you will be given scenario containing one of the above said topics. The sad part is that you need to memorize the marking criteria of these 5 topics in order to be successful station. So how can we successfully pass this station with respect to the marking criteria provided? This video is your answer. Let's learn the topics one by one. In this topic called confidentiality, usually the scenario will be like the patient is having a diagnosis which the patient don't want share with either partner or relative. You will be asked to give opinion on this. I will explore patient's name, reasons for withholding diagnosis, and prognosis from partner. I would offer support and time to facilitate discussion between patient and partner, respecting patient's decision. I will document patient's wishes regarding diagnosis and information sharing. I would acknowledge the partner's concerns and feelings, acting with care and compassion, but explains the need to respect the patient's right to privacy and confidentiality in all aspects of care. I do understand the need to uphold the standards and values set out in the code, prioritize people, practice effectively, preserve safety, and promote professionalism and trust. You should write your actions as bullet points and future tense, in neat and legible handwriting, with respect to the marking criteria. In this topic called drug error, usually the scenario is like you or your colleague has committed a drug error. You will be asked to write down the series of actions you will do after the incident has occurred. You should answer like, I will recognize the possible consequence of error with respect to patient safety, and would take measures to reduce the harm. I would take observation of the patient, will inform nurse in charge and medical team, and would seek advice. I would disclose occurrence to the patient and apologize for what have happened. I will document events, actions and consequences in the patient's record and complete an incident report. I will reflect on the incident in the sequence of occurrence, and will identify factors that may have influenced. I will recognize this as an opportunity, and would identify the need to revisit drug administration procedure. I do understand the need to uphold the standards and values set out in the code, prioritize people, practice effectively, preserve safety, and promote professionalism and trust. Make sure you have memorized the marking criteria for this topic, as your own wordings may confuse examiner. In the possible abuse topic, usually the scenario will be like you are listening something, which you think need to be escalated to your manager or local authority, while you're caring for your patient. You need to write the series of actions you will do with regard to the situation given. I will escalate concern regarding safeguarding, even if the patient is not consenting. I would act without delay, as there is a risk to patient safety, and will raise concern at the first reasonable opportunity. I will raise the concern with manager or local authority, safeguarding lead, as appropriate, in accordance with safeguarding policy. I would make a clear written record of the concern, body map as appropriate, and steps taken to deal with the matter, including date and time with whom the concern was raised. I do understand the need to uphold the standards and values set out in the code, prioritize people, practice effectively, preserve safety, and promote professionalism and trust. Don't forget to memorize the marking criteria for this topic. Usual scenario in professional confrontation would be, you will be witnessing a colleague doing something which is against NMC Code. For example, taking a tablet from the drug trolley and swallowing in front of you, saying that he or she has got a bad headache. You will be asked about how you will act in the given scenario, depicting series of actions. I will talk with the person, and would listen to what he want to say, identifying the problem with the person, and would offer assistance to the person. I would maintain appropriate eye contact and body language. I would offer explanation of the circumstance, and offer apology, as appropriate, as early as possible. I will document the incident, and would offer referral to senior staff member, or the complaints procedure. I will take care of own personal safety and will ensure a witness is present. I do understand the need to uphold the standards and values set out in the code, prioritize people, practice effectively, preserve safety, and promote professionalism and trust. Scenario in this topic of social media will be usually one of your colleague posting confidential information or picture in social media. You need to give the series of actions you would initiate according to the scenario given. I understand that sharing confidential information and posing pictures of people's receiving care without their consent is inappropriate. I understand that it's my duty to report any concerns about safety of public in their care or the public, and failure to report concern will bring their fitness to practice into question and will place their registration at risk. I acknowledge that sharing or commenting on someone else's post can be implied as endorsement or support of their point of view. I will raise concern with manager at the most reasonable opportunity, verbally or in writing. I will complete an incident report recording events, the step taken to deal with matter including date, and with whom concern was raised. I do understand the need to uphold the standards and values set out in the code, prioritize people, practice effectively, preserve safety, and promote professionalism and trust. So in this video, we have covered all the topics that can be asked in the professional values and behaviors station of the exam. We are also giving you a mnemonic to remember for that. Remember REDU, recognize, acknowledge, escalate, document and uphold. Thanks for watching and don't forget to like, comment and subscribe our channel.